as a ritual, welcome to the Retrospective. If you like what you see, feel free to like, subscribe or share. And maybe a back episode piques your interest. In sickness, school medicine is often our first choice, but in the big picture of medical approaches, it's not the only option we have. Most countries have their own traditional paradigms, traditional Chinese medicine and Ayurveda in the East. And then in the West we have holistic approaches such as anthroposophical medicine, integrative medicine and functional medicine. Categorically, these four belong together since their practitioners are normal medical doctors first and specialized thereafter. Today we are interested about the new kid on the block, functional medicine, and its relationship with school medicine. I should note that this is a friendly comparison, and surely there is room in the world for multiple approaches to health. As these can be touchy topics, let's remember that our prime directive applies. Let's look at school medicine first. School medicine shines at acute medical issues such as traumatic injuries, broken bones, dislocated shoulders, etc. Also, sudden onsets of stomach and chest pain are best dealt with classical medical doctors and hospitals. School medicine battles with growing patient numbers and it's challenged at the client interface. In some countries, doctors are allotted mere minutes per patient. Increasing amount of patients feel they are not being heard during these appointments. School medicine is very focused on getting the diagnosis right and then treating it. This makes sense for simple cases, but not so for complex ones. What if the original diagnosis was wrong, maybe a false positive? What if there are multiple factors contributing? What if this is a new sickness? A diagnosis-driven approach to anything is akin to being on a steam train that happily goes wherever the rails go. Everybody on board are predetermined to following the same path. How could this approach ever work on an individual level? Since school medicine is allopathic, its solutions are either chemical drugs or chirurgical operations. To illustrate this one-sidedness, let's look at one common ailment: acid reflux. School medicine eagerly treats this with lifelong proton pump inhibitor medication, which may or may not help, but in any case it causes many other problems down the digestive line. Now, allopathic doctors are merely ignorant of this, since they have received close to 0 hours of education about nutrition. What many alternative doctors know, however, and what, for example, this Norwegian research supports, is that a simple myofascial release technique can help acid reflux patients very well. School medicine is a hierarchical system based on silos of expertise. For example, GPs, internists, endocrinologists, neurologists, etc. It's dysfunctional from collaboration perspective. And what are the client benefits from these silos? Moving on to functional medicine. Functional medicine doctors are experts of nutrition and consider it the foundation of health. They are capable of diagnosing a multitude of digestive problems through extensive lab testing and give guidance on a wide array of dietary protocols, and they understand deeply the connection with gut health and mental health. On top of the typical lab work and diagnostic imaging used by school medicine, functional medicine doctors use the most modern diagnostic methods like immunological panels, genetic testing and heart rate variability testing. Functional doctors focus on the why and the how an illness occurs. In other words, they are trying to find the root cause rather than the right diagnosis. Now, funk docs can use normal allopathic medication very well, but they are not limited to it. Some chronic mystery symptoms can be caused by an underlying heavy metal exposure or genetic deficiency that would simply go undetected by school medicine. For chronically ill patients, functional medicine is a superior choice because these doctors understand modern stressors, namely mental, physical, and chemical. Functional doctors are not afraid to run experiments in trying to find out what helps an individual constitution. Patients are not in a steam train anymore. They are free to try out new things, obviously within common sense. This kind of positivity and open-mindedness can lead to lasting results and improved self-knowledge. Hold on, did he say root causes? Did he say measurements? Experiments? It's Agile! You bet it is! To summarize, functional is to medicine what Agile is to teams. Agile mindset, combined with the best lab and treatment toolset, makes functional medicine approach superior.